My name's Sarah Byford. I'm a professor of health economics at King's College London, and I was responsible for the economic evaluation that was carried out alongside the BESST trial.
Brilliant. So would you say the Discover workshops are cost effective?
The short answer is yes. What we showed was that the intervention group still cost more than the comparison group because of the cost of the intervention. But because the intervention was effective, we estimated that it was a price worth paying. And this is below the threshold that NICE, the National Institute for Health and Care Excellence, would class as cost effective.
And so in terms of cost effectiveness then, how would that compare to other mental health interventions that you've seen?
So it's a really interesting question. We've had quite a few negative trials in schools recently in areas in mental health, including a couple that I worked on most recently, the Myriad MBCT mindfulness study, which was negative. And another one was Incredible Years Teacher Classroom Management, a little bit older, but again, it was a negative trial. But actually, for both of those, it was the effectiveness that was the issue, not so much the cost effectiveness. And this is partly because these young people tend not to be very heavy service users. So there's not actually much money to save to make something appear cost effective. You need an effective intervention. The Discover workshops in the BEST trial were effective, and that's something that we haven't seen very much of recently for school-based studies.
So how can kind of school leaders understand health economics when it comes to deciding which interventions they actually want to use in their schools?
Yeah.
My feeling actually is that they should decide on the basis of the effectiveness rather than the cost effectiveness. Questions I would be asking myself as a school is first, who is delivering the intervention? And we do see differences if teachers are delivering, because that involves a lot of time out of the classroom, a lot of training. They then have to get their heads around delivering the intervention in class. In my view, we're seeing better results from interventions like the Discover workshops that are delivered by mental health services or paid for and provided by the NHS. So I would be choosing an intervention that's delivered in the NHS within schools rather than the school providing an intervention themselves. It's so hard going into schools, finding time to fit these types of interventions. And again, I think this is something that BEST did really well, for it just to be a single day delivered not by teachers, but by trained mental health professionals instead. Those are the things I would be looking out for. And the chances are, if it's an effective intervention, it will also be cost effective.
Yeah, I think this is really interesting because I work with a charity who actually provide funds for mental health interventions to go into schools. So it's really amazing. And when we're going to funders, it's actually really hard to get funding, and it's all about statutory funding. But we know there's so many different parts to this in terms of making sure that the schools can actually get these interventions.
We have to remember, if any costs are saved, it'll be saved in the NHS. And so it's a lot to ask schools to pay to deliver an intervention where they're not going to see the savings. I mean, they may see improvements in young people's behaviours and attitudes, but fundamentally, it's the NHS that will save money from reduced referrals to CAMS or other mental health services. So for me, I think it makes more sense for the NHS to be delivering interventions in schools rather than relying on schools to figure it out for themselves.